You know, it was about 2 years ago, if I'm not mistaken, you can correct me about this. Measles was almost eradicated. And all of a sudden, we saw a recrudescence of measles within our communities, unique communities, people that say, no, we're not going to take the vaccine, whether due to vaccine hesitancy, but we had a disruption in what the herd immunity was. So my question is there a parallel with COVID and herd immunity? And are there maybe better examples to kind of like use an example to talk about the real importance of achieving herd immunity?
That's a great question. What comes to mind is when I was a freshman, my first year, I'm dating myself, my first year in medical school, they put up first day, they put up a movie put together by World Health Organization about the eradication of smallpox. Okay, and basically what happened was that smallpox was a kind of a unique disease. The only carrier is humans. There's no animal reservoir like there is animal reservoirs for flu or for COVID, for example. So because it's only in humans, it's one of those things you could actually eradicate from the entire planet if you get all the human cases. Okay, so basically they went, and it was all in Africa, and they would go from area to area to area, and they would go to a settlement, and they would immunize whenever there was a case, and immunize everybody, on and on. So they ultimately achieved their goal in the late 70s of completely eradicating smallpox. There's no smallpox, and that's why people don't get smallpox vaccinations anymore. The only place there is smallpox viruses in research laboratories, where it's under very significant lock and key. So herd immunity works. And even though it wouldn't work as effectively for COVID or for flu, or for that matter, for any process that's not uniquely special only in human beings, it is effective. I was looking up in preparation for this, I looked up on the website to see how many people have been vaccinated so far in the States, and it was actually better now than I thought it was. 63% of people over 18 years old in the US as of this week have gotten at least one shot, and 52% over 18 have been fully vaccinated. And for the 65 and above group, 86% have one shot, and 75% of the over 65-year-old population has been vaccinated. We've administered as a country 300 million shots, which is really an amazing achievement. Accolades for everybody that's participated. It's always been a huge effort. The problem is that we're not an island. So the rest of the world, except for a few countries that are fortunate, are lagging way behind the United States. So as long as we don't get the entire world involved in eradicating this, then we're always going to be at risk. Having said that, the numbers that we've got are great. We need to do better. We need to keep pushing. And one thing that we really need to work with is vaccine hesitancy. It's a huge issue. And now a lot of the people who have, because everybody now that's over 18 certainly, and now we've opened it to younger, has access to the vaccine. So the problem is, why aren't people taking it? And a lot of it has to do with fear, and there's some political issues, I'm sure. And a lot of it has to do with people not understanding the safety of the vaccine. It's an amazingly safe, effective vaccine. It does not alter your DNA. It's out of your body in less than a day. The reason why people get so sick for it is so strongly immunogenic. It causes such an excellent immune response. And that's all it is you getting a good immunity. That's what the response is all about. It's just unbelievable. So we need to work really hard on our family and our friends to try to encourage them to understand why these vaccines are so valuable to us. Not just for ourselves, to protect ourselves, but to protect everybody that we're exposed to and everybody that we care about. So getting back to your initial question about vaccine hesitancy, it's there. It's a huge issue. Herd immunity is critical, and the major way we're going to get there is with the vaccines. So we need to get up there a bit more.